I am Dr. Amna, your host for today. So, International Association of Oncology is one of the world's leading professional associations serving oncologists and life science professionals across the globe. International Association of Oncology, or IAO, is a non-profitable professional association meant for encouraging cutting-edge research and development activities in the field of oncology, life science, and health sectors. So IAO serves as an international forum for researchers, academicians, doctors, and practitioners for sharing knowledge and innovation in the field of healthcare and life sciences. IAO aims to bring together worldwide researchers, professionals, encourages intellectual development, and provides opportunities for networking and collaboration. IAO delivers access to its members, the industry's most essential technical information by organizing conferences, workshops, annual convention meetings, and provides networking opportunities both locally and globally. Members can stay up to date in their chosen profession, connect with peers, and invest in their future. IAO also provides a broad-based home for members and societies who are interested in the aspects of medical oncology, surgical oncology, radiation oncology, palliative care, and life sciences, together with pharmaceutical industries, hospital and medical institutions, government and private organizations, industrial researchers, and academic researchers. So, talking about today's Indo Oncology Summit, so BioLeagues Worldwide, in association with International Association of Oncology, gladly invites all the participants across the globe to the most prestigious Indo Oncology Summit, which is held annually. So, the aim of this conference is to encourage research and innovation in the field of oncology. Indo Oncology Summit has a rigorous scientific program that appeals to the entire spectrum of cancer researchers, those with interest in discovery-based, translational, clinical, and population-level research involving the recent advances, exploring the current scientific challenges, and considering the merits of emerging therapies in the areas of lung cancer, breast cancer, prostate cancer, gynecologic cancer, multiple myeloma, and lymphoma. I welcome you all again for today's poster release ceremony. So now moving ahead with today's program, I would like to welcome our honorable speaker, Mr. Rudra Bhanu Satpathy. So he is currently the Chief Executive Officer of Techno Array Group, Chennai, Tamil Nadu, India. I welcome you, sir.
Thank you very much, Amna. Good evening. Good evening, everyone, all renowned doctors, health science professionals, and professionals and leaders of in field of cancer sciences and oncology. Today, we have eminent experts, doctors with renowned awards all across the India as well as all across the globe. Those who are watching this ceremony today, and we have sent the invitation to all of you. Thank you very much for your valuable time to join us today and giving time towards the responsible association of International Association of Oncology. Apart from this holiday today, I think most of us will be having a leave today, and this evening is a very auspicious evening, I would say. We celebrate this day as Makar Sankranti, and we celebrate this as New Year's in different states of India. And this day is culturally, socially, scientifically, and seasonally very important for all of us. And on this auspicious evening, I feel privileged to represent International Association of Oncology and be a part of this ceremony to unveil the initial poster for 4th Indo Oncology Summit. So Indo Oncology Summit is not merely a cancer conference, it's not merely a scientific event. It's basically the emotion of doctors of eastern part of the nation and the oncologists of Odisha, those who have contributed and try to bring this event come forward with international opportunities and scope. So with successful series of 3 conferences we organized, and we began with the leadership of our Honorable President, Dr. Ghanshyam Biswas, the current President of International Association of Oncology. And we began up the conferences, and after completion of the 3rd series, which was virtually organized, we are moving ahead towards the 4th International conference on Indo-Oncology Summit scheduled on 23rd and 24th of September this year, and which will be bestowed with thought-provoking speakers all across the globe. We are partnering with all leading research cancer centers, leading hospitals, leading associations all across the globe, and we are in a verge of establishing a great scientific committee with great leaders, those who come forward and give excessive outcomes and share their knowledge, exposure, and their network towards the welfare of the cancer societies, welfare of the cancer patients, welfare of the cancer affected and cancer saviors also. So today, our nation and Asia is combating with cancer. This horrific disease is a challenge today, and all responsible doctors, associations, and members of different scientific communities are stepping forward. We feel privileged, and we also are honored to render our scientific and networking services to everyone. We are connecting with all the doctors, leaders, and health science professionals all across the globe, so that the scopes and research opportunities available in the nook and corner of the world could be available for the development of the scopes and scientific research opportunities of India. And we are doing with this vision, we are organizing this series of conference. Hopefully this conference will be a great experience, and I'll request our president, Dr. Ghanshyam Biswas, to take ahead. And I express hearty gratitude to everyone for your valuable time to be part with us. Thank you very much.
Thank you, Mr. Rudra. There was those were some lovely words. I would like to request our honorable speaker and president of our IAO association, Dr. Ghanshyam Biswas. He is currently working as an executive. Just a minute. He is currently working as an executive director and medical oncologist at Sparsh Hospital and Critical Care, Bhubaneswar, Orissa, India. So Dr. Biswas has been serving as an organizing secretary of Indo Oncology Summit. So, sir, I kindly request you to share a few words about this fourth edition of our upcoming Indo Oncology Summit 2022 with our audience.
So good evening all. So as Mr. Rudra rightly said, so today is an auspicious day for most of our countrymen. So we are celebrating a new year. And thanks Amna and thanks Mr. Rudra for those kind words. So COVID pandemic for last 2 years, and we don't know, so we are ushering into another pandemic or not, but science has not stopped, and cancer was never on a vacation. So probably in COVID times, we have seen lots of development in regards to cancer treatment, and many of the standard of therapy has changed. So the grim side of cancer is no longer there. So we now understand the biology of the disease. We now understand that there are plethora of options for many hard to treat diseases. And all this has come because of research and innovations, because of peer connect. So we can reach, we can understand, we can see the development through the eyes and through the net we have. So we are planning, we are today here to launch or a teaser for the poster of the 4th Indo-Oncology Summit, which we are planning the last week of September. So Friday, Saturday, Sunday, or Friday, Saturday. So we can decide on that, because as you understand, so each day for a scientific congress, and if COVID doesn't happen, so if everything goes physical, so definitely then we'll have people coming from different parts of the country and also overseas. So we have some certain things in the mind as a theme. So it can be, this congress can be related to something like COVID. So we have just won over COVID. Second, it can be because these 3 years of World Cancer Day theme is close the care gap. So we understand that cancer treatment, especially in the developing country, is not reaching to many people because there is a disconnect. And third can be, as we were discussing in our own forum here, that cancer resources in a lower middle economic countries. So we can zero down to one of these themes, and we can start preparing for those 2 or 3 days of conference. And so we are planning to do these physical meetings somewhere in we have located a few of these hotels. So we are yet to freeze down with everybody's consent, because we have been doing in Mayfair, Swasti. So now in this COVID time, we have new like Lemon Tree, we have Taj Vivanta, ITC. So we look at our own budget, and then probably we can zero down, so that you will have, so you have a good science, you have a good food, and then a good ambience. So that's more important. So we promise that, so with each passing year, so will raise the bar, and we'll try to cover what's happening in the field of oncology, the developments. So this is not only we are looking at the treatment part, so we will also look into the research. We can have collaborations, but these 3 years of Indo Oncology Summit has been a phenomenal. So there are many people throughout the globe and throughout the country have got connect as a part of India International Association of Oncology. So we have been doing at least 2 to 3 webinars in the last 2 years, and people have realized that we are doing a good work. So I think so with the fourth Indo Oncology Summit, so we will expect those good wishes and the blessings, and everybody's cooperation for this Congress to happen. If God forbid there is no more COVID, then we can meet, we can see each other, and probably we'll have a good science and a good collaboration. Thank you so much.
Thank you so much, Dr. Biswas, for your words. So, we'll be moving ahead with our today's conference and introducing the poster as well. I'll be transferring now. I would request Mr. Rudra Bhanu so to say a few more words regarding today's conference.
Thank you very much, sir. And hopefully it was a right platform for the discussions. And this conference, we had the initial launch of the poster today. And at the upcoming days, we will be keeping posted with the updated brochures, the posters and websites. I urge everyone for the scientific contribution. I urge everyone for the involvement, because these type of conferences we do for the community, we do for the societies. These are not possible without the support of everyone, without the scientific, without the academic, without the professional support of all our committee members. And we are proud to say that we have a team, and we have a strong network of oncologists all across the Asia, India and globe. And I urge everyone to be a part of the organizing committee, to be the scientific committee. I request everyone with their outstanding knowledge and skills to come forward and contribute to the agenda and make the conference more content oriented and more scientific, so that this could be redirected towards the community and could be contributing for the welfare of the community fighting against cancer. Thank you very much, everyone. Thank you, Amna.
Thank you so much, sir. On behalf of Indo Oncology Summit and International Association of Oncology, I heartily thank all the delegates, associates, partners, sponsors, professional members, student members, and all our beloved participants who have taken time and joined us today. And also to make this a great success. So together, let us make this year's 4th edition of the Indo Oncology Summit a grand success in the truest sense. Thank you so much for your time, patience, and support. And we really look forward for your continuous support and engagement. So the conference registration link and the conference website link is
very sorry for the interruption, Amna. Now I would like to invite Dr. Biswas sir to release the teacher poster, sir.
I would request Dr. Biswas to kindly release the poster for the 4th Indo-Oncology Summit 2022.
So thank you, Amna. So I hereby release the teaser poster for the 4th Indo-Oncology Summit. So as you rightly said, so Friday, Saturday, and Sunday, that is last week of September. So we are hosting this conference physically and maybe to some extent hybrid for those who may not be able to reach, especially the international delegates and faculties. So this will be in Bhubaneswar, India, and September will be a pleasant here in Bhubaneswar.
Thank you, Dr. Biswas. So now on behalf of Indo-Oncology Summit and International Association of Oncology, I heartily thank all the delegates, associate partners, sponsors, professional members, the student members, and all our beloved participants who have taken time and actually joined us today. So since the poster has been released now by Dr. Biswas, thank you so much, sir, again for that. So together, let us make this year's 4th edition of the Indo-Oncology Summit a grand success in the truest sense. So I thank all the participants here for the time, patience, as well as their support. And we really look forward for your continuous support and engagement in the future. Thank you so much, everyone.
Thank you so much, sir.